Good. I'm Dr. Firnhaber. Tonight we have our talk on chiropractic and children. And so, as usual, anybody in the back can come sit up in the front. We still have some chairs available. And so tonight we're going to talk about children and health. So one of the things that I have found in practice over the years is that even though I take care of a lot of kids, I take care of multiple families, is that there's a lot of parents that are really reluctant to bring in their kids for care. And they love the care, they love chiropractic, they love what I do, but it's almost like they're saying, well, wait a minute, when it comes to my kids, this is serious. It's serious business. Chiropractic is good enough for me, but I don't know if I want you, messing with my children. And that I find that puzzling, okay? And the reason I find that odd is let's just talk about health and healing. So let's start at the very beginning. Our bodies are self-healing organisms. The power that made the body heals the body. It's that simple. It's that simple for adults, and it's that simple for kids. And so what I would ask is this: do you think it's better to bring a child into a chiropractor or fill your child full of toxic medications? Right now, if you look at where this whole vaccine mandate is headed, it's headed towards vaccinating babies before they leave the hospital. And so the question is what's safer? Are drugs, now drugs are sometimes appropriate for kids, but are drugs safer, or is natural health care safer for a child? You got to think about that. Remember, the power that made the body heals the body. The same things that work for adults will not only work for kids, but it'll work a lot faster in children. Children get better faster than adults do because they're not so torn up and worn down and degenerated like so many of the adults that I see. So let's get into kids and chiropractic. So we know that the body heals through the nervous system. We live through our nervous system. This is the autonomic nervous system. All the organs are connected to the spine. And so if a child is subluxated, which they can get subluxated, we'll talk about that a little bit more, their organs can malfunction just like the organs of an adult. So the first subluxation that a child often experiences is birth trauma. The risk factors for birth trauma include the following: large for date infants, especially infants who weigh more than 4,500 grams. Instrument deliveries, especially forceps. And finally, vaginal breech delivery or abnormal or excessive traction during delivery, pulling on the head. That, my friends, is often the start of health problems in a child. Now, my mother, who didn't necessarily have a traumatic birth, was kicked in the head by a horse when she was 2 years old because she lived on a farm where they were still using horses to plow when she was little. She was kicked in the head, and all of her health problems started then with that subluxation, with that whiplash type injury. So, and all the drugs that they tried to give her never worked. It wasn't until she found chiropractic that she got better. And that was a lot later in life than it should have been for her. So here's a baby being born C-section. You can see they pull them out by the head, okay? Birth trauma to the cervical spine and cranium can result in these disorders. Now, this is out of a medical journal called Orthopedic Medicine. It can result in headaches, vestibular problems, which is dizziness, auditory troubles, which is hearing, visual disturbance like cross-eyed, pharyngolingual disorders, which is speech disorders, vasomotor and secretion dysfunction, and psychic disturbances. So care to the neck, to realign the neck, achieves excellent results with many of these dysfunctions. And again, that's out of the journal called Orthopedic Medicine. Can chiropractic help kids with infections? Well, there's an article in the Journal of the Manipulative and Physiological Therapeutics back in 1991, and it showed that research shows that a single chiropractic adjustment causes a burst in the amount of neutrophils and monocytes, both important cells in the immune system. In fact, neutrophils and monocytes are part of our primary immune system, which is like the 800-pound gorilla in our immune system, which is broken in a lot of people out there, which is why these vaccines that they're giving people are not working and people are still getting COVID. It's because the primary immune system, the neutrophils and the monocytes, which require proper amounts of nutrition, that system isn't working well. So what about chiropractic and respiratory disease? Again, this is JMPT, the same journal except 2012. It says the use of manual techniques on children with respiratory diseases seems to be beneficial. Chiropractic, osteopathic medicine, and massage are the most common interventions in kids. One study, now this is a study that was in 1966. You'd think you'd have heard of that. And this is in it's in the Journal of the American Osteopathic Association. They looked at 100 families and 4,600 cases of upper respiratory infection in children. And what this demonstrated was the following. Osteopathic manipulation was superior to antibiotics. If children were adjusted as soon as symptoms began, complications were less frequent. Most of the time, complications such as bronchial pneumonia or conjunctivitis could be treated with extended adjustment periods. Prophylactic use of antimicrobial drugs, which is antibiotics, could cause complications to be more difficult to treat. Now, this was back as far as 1966. Has anybody ever heard of this article?
Nope.
Nope, nobody ever heard of it. Why? Because things like this were not talked about. They were considered irrelevant. What was happening in the 1960s regarding pharmaceuticals? Anybody remember? Pharmaceuticals were really on the way up back in 1966. I mean, the pharmaceutical industry was really revving up back then. So this was not considered a very modern way of treating children, yet it's a very good study, published research. What does the AMA have to say about antibiotics and upper respiratory infections in kids? This is 2016. More than 250 million outpatient antibiotics prescriptions are written in the U.S. each year, most of which are for acute upper respiratory infections. A large proportion of these prescriptions are unnecessary. That's a JMA. Antibiotic overuse leads to unnecessary adverse drug effects and antimicrobial resistant infections which harm patients. So maybe when your child gets sick, maybe drugs aren't necessarily a good idea for the first line intervention. You can always use them if you need them, but according to this article, there's a lot of antibiotic prescriptions that aren't necessary. And this is Journal of the American Medical Association, February of 2016. What about chiropractic and epilepsy? We don't have any definitive studies in this, but anecdotal evidence shows that chiropractic can be very beneficial for epilepsy. And to me, it would make sense that if the child had birth trauma, birth injuries, or head injuries, that looking at the spine and the nervous system from a functional standpoint might be a much better way of approaching this problem rather than drugging the child for life. So does there need to be more investigation? Yes, but this is an article, out of JMPT, The evidence suggests that correction of upper cervical subluxations might be beneficial in epilepsy. Chiropractic versus medical care. This is a very interesting study. So 200 chiropractors and 200 pediatricians were sent questionnaires on the health of their children who were under the different types of care. Questionnaires came back, they analyzed them. The chiropractic group had fewer ear infections, less tonsillitis, fewer allergies, and fewer cases of asthma. The health of the children under chiropractic care was demonstrably superior to the children over the children who had not received it. So a 1999 study which compared chiropractic and pharmaceuticals in the treatment of colic showed that chiropractic was superior to drugs. I've treated kids with colic, they respond well. Chiropractic and laser, I don't know of a lot that's better than that for colic. And by the way, here's what I hear from some parents, is that some of these young kids that spit up a lot are being put on proton pump inhibitors, and they're infants. Now, were these kids born with a proton pump inhibitor deficiency? I don't think so. I probably spit up when I was a kid and I didn't need them. And so those kids need to be adjusted and they need to be lasered. So Heidi Havoc, which is a leading neurological researcher in New Zealand, has published many studies on chiropractic and brain function. And she's shown that chiropractic care has proven to modulate or improve sensomotor integration. This is how the integration of the brain and the body to perform movements accurately. This could help kids who tend to be clumsy. Chiropractic could help them in sensomotor integration. Many published studies show that chiropractic can help children with bedwetting. B vitamins are also helpful. So I've treated kids with bedwetting successfully. And you probably have too, Dr. Adam. And chiropractic can really help these kids. They don't need to be embarrassed for the rest of their life or for years. This is in the Journal of Manual Medicine, 1992. This is a report, it's a case study that shows the abrupt improvement in mental and motor deficits in a 14-year-old girl after the initiation of specific upper cervical chiropractic care. What about athletics? Another very interesting study, Journal of Chiropractic Research and Clinical Investigation, 1991. They had 50 athletes, divided them into two groups. And they looked at 11 tests just to measure their athletic ability. They adjusted one group of patients for 3 months, the other one they didn't. Here's what happened. After 3 months, it was demonstrated that the chiropractic group improved significantly on all 11 tests, whereas there is no improvement in the control group. So if your kids are going out for athletics, might be a good idea to adjust them. They might excel a little bit better. Chiropractic can help kids with tonsillitis. This was in Dynamic Chiropractic, 1994. So do you have to have antibiotics for tonsillitis? Do you have to take the tonsils out? Oh, not necessarily. You can adjust them. Now, another thing that I will do for kids with tonsillitis is I'll put on a glove on my hand and go in and just stroke down on those tonsils and flush the toxicity and the pus and some of that out. And they tend to heal a lot faster. Then you laser them. Very, very powerful combination. In 1975, the Journal of Trauma reported that trauma to the cervical spine causes headaches. Children can get spinal trauma through minor falls, auto accidents, and sports. So what does this say? If your kids are having headaches, they don't need Excedrin, they don't necessarily need Bayer or Tylenol. they should have their neck checked out. Do a little case history on them. Find out if they hurt it. If they hurt it in a fall or in a sports injury, and they should at least get checked. At least get their necks checked out. Children and adolescents may be able to. Okay, let me just say what this is saying. When a kid gets a concussion, it's harder and it takes longer to heal that concussion in a child than an adult. And they tend to develop persistent symptoms if it isn't handled properly. Now, this is in the Journal of the Pediatric Neurosurgery, April 2019. Girls carry a much higher risk of concussion than boys do. So the teenage time is a very vulnerable time for damaging the brain. Now, here's the issue there. Mild traumatic brain injury can be helped with chiropractic, low-level laser, and specific nutritional formulas. And we know this for a fact. So a study came out in 2017 that showed unless the cervical spine is corrected with specific manipulation, brain injury may be long-term. So think about that. If your kids have had a concussion, if they've been in sports and got, a head injury, or they've had falls or been in a car accident, that cervical spine needs to be treated. The neck must be corrected. And it shows, again, that study shows in 2017 that unless the cervical spine is corrected with specific manipulation, brain injury may be long-term. So, you look at all these high school sports being played, really, they should have a chiropractor out in the field. They should have a chiropractor on the sidelines to check these children out. And they should be referred to a chiropractic office when they have a cervical sports injury or a concussion. They don't need to be on meds. They need to be adjusted. So, in fact, let me tell you about, I had a young woman who plays soccer that came in to see me, and she had seen another talk that I do where I talked about concussion, and she had been hit in the head with the soccer ball pretty hard, and she came into me, and she, I did some an exam on her and did some tests, and she was definitely concussed. And I worked on her for several, 2 visits, 3 visits, corrected her neck. She was already a patient of mine, did some laser, and she was fine after that. There were no long-term effects of that injury. So I know just from treating these patients that chiropractic and laser work really, really well for this. And so if you have children, that are in sports, and they've had some issues, you might want to have them checked out to see if chiropractic can help them. So the best doctor is the one inside of you. And again, I just want to emphasize, the body heals from above down, inside out, through the nervous system. The power that made the body heals the body. Now, the last thing I'm going to say is this. Many of you probably know families who have kids that have health issues. Kids that may have some ADD and ADHD, that have some brain dysfunction. There's a good chance that chiropractic, laser, and clinical nutrition can really help these kids. And why should these kids have to go through life with problems when actually there's a chance that natural health care can help them and give them a lot more function. And I've treated kids on the autism spectrum disorder, and they do so much better. I'm not saying they get completely well, they get completely free of autism, but they do a lot better. And so I would say this, who do you know that has kids that have problems? Have them come in and get checked. At least get checked. They don't necessarily have to be a patient, but at least get their spine checked. At least get them checked for subluxations and see if they have a problem that we can help, because we may be able to help them and save them from a lot of problems long term. I had a young man, this is several years ago, I still see him as a patient, but he took a particular supplement that I have that completely changed his ability to think clearly. And he made this interesting comment. He said, if I would have had that in high school, my whole life would be different. And I would say this, that supplement may not work that way for every single person, but there's a lot of people, if they could get the right kind of natural health care, their whole life would be different. And so I'm going to ask all of you here and all of you listening, if you know of somebody, have them call the office. Let's check them out. If we can't help them, we'll send them somewhere else where they can get help. But if we can help them, maybe we can change their lives, and that's what's really important. So that's all I have for tonight. We finished quite a bit early tonight, and so I thank you for listening. God bless you. And the next talk that we have is in 2 weeks. It's on the sour truth about sugar. It is a great talk to do right before the end of the holidays. So I would really recommend that all of you come and listen to this talk. So we'll see you in 2 weeks.